Hello po, magandang araw po sa lahat mga ka-nursing. Welcome back po ulit sa ating channel, and for today's topic, we are going to discuss your family nursing care plan, specifically the two levels of your assessment. So in your family nursing process, we know that there are five steps of the nursing process. This includes your assessment, followed by your diagnosis, then your planning, then your implementation, and the last part would be your evaluation. So before we can go to the other parts or the other steps, we can proceed to the other steps, we have to go first with the first step, which is your assessment. And part po ng ating assessment under your family nursing care plan is to identify the nature of the problem of the first two level of clientele, which is the individual and family, which will now bring us to the topic that we are going to discuss today, the typology of the problems or the typology of the nursing problems in the family nursing practice. So basically, there are two major typology of nursing problems in the family nursing practice. Of course, we have the first level of assessment followed by your secondary level of assessment. So these two typology of nursing problem in the community will now determine the nature of the problem. It is important for us to know the nature of the problem in terms of identifying which problem in the family should be prioritized first. Because as we all know, once we go and enter the family or the family's home, we will not be able to identify only one problem. So there are several problems that we will be able to identify. And the thing is, we cannot provide an immediate solution, okay, together with the family to these types of problems within the family. That is why we have to prioritize which problem should we address first. And in terms of the prioritizing problems in the family nursing care plan or family nursing process, is that we need to identify first the nature of the problem. Okay? Kaya pag-uusapan natin for today yung first level of assessment and your secondary level of assessment under your family nursing practice. So let's discuss first your first level of assessment. When I talk about first level of assessment, guys, this is basically identifying or checking or determining the existence, okay, the existence of or the presence of existing and potential health conditions that can affect the optimum level of functioning of a family. So basically, we are going to identify any failure of the family to maintain their level of functioning, okay, any activities they do to improve to improve their wellness, okay, any presence of risk factors that can affect their activities of daily living, and of course any situations that will change their overall health status, okay, for in general. Okay, so yun po yung pag-uusapan natin under the first level of assessment. So under the first level of assessment, okay, this is basically identifying if the family has the presence of wellness condition. Okay, we are going to define each and every one of these later on. Another one is the presence of health deficit. Okay, and the third one is the presence of health threat, and of course the presence of stress point. Okay, so the presence of stress point. So we are going to define each and every one of these, and we're going to provide examples for better understanding. So let's start first with the presence of wellness condition. When I talk about wellness condition, so this is basically stated, okay, stated as a potential or readiness, okay, a potential readiness. By the way, when we try to identify the assessment or para kasi ito na yung magiging pangalan ng diagnosis, okay, of the problem of the family compared to fundamentals of nursing. Okay, ginagamit natin yung NANDA. Okay, but for community health nursing, we are going to make use of this typology of nursing problems in the community. Okay, as I've said earlier, wellness condition is um it's stated as a potential or readiness. Okay, and when we try to define what is wellness condition, these are any clinical or nursing judgment about the client's transition from a specific level of wellness or capability to a higher one. So basically, these are any good traits, any good activities, any good a practice of the family that maintains um, maintains them to have a healthy living or an optimum level of functioning, or basically in order for them to have a wellness condition or yung tinatawag natin magandang kalusugan. Okay? So these are any activities na ginagawa nila para ma-maintain yung mga situation na ganon. So yung maging healthy sila, and of course which are less likely to have diseases or to commit failures to maintain their optimum level of functioning. Okay, example of your wellness conditions or the presence of wellness of conditions are the following. So these are potential for enhanced capability for a healthy lifestyle. Okay, healthy lifestyle meaning they are eating good, they're doing exercise, their lifestyle is not sedentary. Okay, they are avoiding vices, hindi umiinom, hindi naninigarilyo. Okay, which is the number one risk factors na talagang related sa lahat ng sakit, which is also common in the community. Okay, now another one is health maintenance and health management. So basically, if the family is fond of doing the right thing whenever someone from the family member is sick, so nagpapa-check up sa hospital or sa doktor, sa talagang doktor, okay, that is a good maintenance activity, health maintenance activity and management. Parenting and breastfeeding activities, because breastfeeding is an example of a an activity that will prevent a person from acquiring diseases or increasing the immune system, especially for a baby or an infant. Okay, so that's why if a mother breastfeed their child, that is an example of a wellness condition because that is a sample of an example of strength of the family. Okay, basically, yung pamilya is may magandang traits that will maintain their optimum level of functioning. And of course, good parenting skills. Good parenting skills, because if you have good parenting skills, basically your children will grow healthy then. Okay, another one is spiritual being. Okay, sabi nga nila, a family that prays together stays together. And of course, if they pray, if they maintain their spiritual well-being or the connection with the higher above, okay, kung sino man po yung kanilang sinasamba, okay, that is basically will try to improve their overall condition as well, especially yung kanilang spiritual and psychosocial status, okay, and other that may specify. And it can also be stated in a form of readiness for enhanced capability for. So basically, wellness condition are any activities, any anything that the family will do to maintain an optimum level of functioning or a good healthy status. Okay, so hindi paninigarilyo, hindi pagkakaroon ng bisyo, pagkain ng masustansya, ibig sabihin yung laging may presence ng gulay sa pagkain, iniiwasan ng matatabang pagkain, ng maaalat na pagkain. So anything na ginagawa nila para maiwasang magkasakit, okay, is an example of a wellness condition. And in the prioritization, wellness condition actually scores 3 points, okay, which is one of the priority. So ang score niya is 3 kung i-scorean po natin ang wellness condition. So aside from the presence of wellness condition, another first level assessment is your health deficit. So madaling-madali lang po intindihin ng health deficit. When we talk about deficit, okay, from the word itself, deficit, there is already a failure. Okay, there is already a failure. Failure to what? Failure to maintain, okay, to maintain, okay, oh, I'm sorry for that. Failure, okay? Failure to maintain an optimum level of functioning. Ibig sabihin, may nangyari na sa katawan, naapektuhan na ang kanilang kalusugan. So let's go with the definition. So we'll talk about health deficit. This is an instances of failure in health maintenance. Sabi ko nga kanina, may nangyari na sa kanyang kalusugan. Nagkaroon na ng failure in maintaining a person's health. An example of health deficit or the presence of health deficit is that if a person has an illness state, okay, illness state, for example, isa sa miyembro ng pamilya ay may diabetes mellitus, merong hypertension, merong scabies, okay, scabies. So let me just remove my pictures here. Ayan. So, scabies. Okay, so meron siyang scabies. So, yung scabies basically a skin condition. Scabies. So, those are example of illness state. So, anything na yung isang membro ng pamilya ay nagkasakit or may sakit, the condition of that person is an example of an illness state, which is a health deficit. Another one is if there is a failure, okay? Failure, okay, to develop according to normal rate. For example, meron kang anak na ang height is less than to what is expected according sa kanyang edad. Okay, kung mas pandak siya or meron siyang visible muscle wasting or may malnutrition. Okay? Pandak o kaya or hindi na tumatangkad or yung timbang is mababa sa kanyang edad. So that is an example of presence of health deficit as well. Okay? And of course, disability. So any form of disability, may it be neurological by nature, like your stroke. What else? Blindness is an example of your disability as well. Ano pa? Orthopedic by nature, or walang isang kamay, or kulang ng isang paa, kulang ng isang kamay. So any form of disability is an example of your health deficit. Later on, we will try to compare everything on the last part. So don't you worry, guys. We will try to practice more regarding this. Okay. Another is your health threat. By the way, with regards to your health deficit, let me just go back to that. Okay, kung kanina ang wellness state natin ang score is 3, this also scores 3 according to prioritization. So, according to prioritization, ang score po nito is also 3. 3 din po siya. So, sa mga next videos natin, I will going to teach you on how to compute, okay, for the prioritization computation na tinatawag in terms of the family nursing process. Okay, we will going to discuss that on our next videos. Okay, next is your presence of health threat. So presence of health threat is basically a condition that are conducive to disease, accident, or failure to realize one's health potential. So basically, pag sinabi nating threat, health threat, nandun na po yung salita, health threat. So basically, these are any condition that will make a person vulnerable, okay, to develop a certain disease, accident, or failure to realize one's health potential. So anumang bagay na pwedeng mag-contribute sa pagkakaroon ng sakit, maaring maaksidente ang isang tao, or hindi niya ma-maintain yung kanyang optimum level of functioning is an example of a health threat. So basically, a person does not have the condition yet, but there is a factor that can contribute to the development of a unhealthy condition. So like for example, let's go with examples. For the presence of health threat, the presence of risk factors. For example, if a person is smoking, we all know as nurses, okay, cigarette smoking is the #1 risk factor. Actually, as a matter of fact, parang sa lahat ata ng sakit, okay, pwede nating ma-relate ang paninigarilyo. Okay, so if a person is smoking, okay, kahit wala pa siyang cancer, but the situation wherein one of the factors that can contribute for the development of a certain condition, such as your cancer, cardiovascular diseases, or your stroke, is present, which is the cigarette smoking. So the presence of risk factor. Another one, okay, pagkakaroon ng a member of the family has a communicable disease. If a member of a family has a communicable disease, that there is a possibility na pwedeng mahawa yung ibang member ng family. So there's a threat of cross-infection, and that is another example of your health threat. Another one, family size beyond what family resources can adequately provide. As you can see, there is no problem yet. However, okay, the number of the family can affect the ability of the family to maintain yung kanilang to also sustain their living, including the management of their health, because if the money that the family has is not enough for the entire family to live with. Okay, kung nahirapan na nga sila sa pagkain, more or less mahirapan din sila kapag may nagkasakit. And that's an example of a threat na hindi magawan or hindi ma-manage yung condition kasi nga the lack of funds. Okay? So those are examples of your health threat as one of the nature of the problems in the family nursing practice under your first level of assessment, okay, in the family nursing practice. And by the way, if we are going to score this in the prioritization, your health threat will score 2 points, okay, compared to wellness and health deficit, which is both 3 points. For health threat, it's only 2 points. Okay. Now, the fourth one and the last one under your first level of assessment is the presence of your stress points. Okay. The presence of your stress points. If we talk about the presence of stress points, these are anticipated periods of unusual demands on the individual or family in terms of adjustment or family resources. So basically, these are any situations in the family that requires them to adjust in terms of their family resources. Okay, in terms of family resources. And by the way, your stress point is also known as your foreseeable. Okay, I'm sorry for that. Foresee. Okay, able crisis. Okay, so your foreseeable or foreseeable crisis. Okay, foreseeable crisis. So this is also known as your foreseeable crisis. Okay, foreseeable crisis. I think wala tayong R doon. Foreseeable crisis. So stress point is also known as your foreseeable crisis. So these are examples of your presence of stress points. Okay, number one is marriage, then followed by pregnancy, labor, puerperium, and parenthood. So these are basically developmental changes that will bring about stress conditions or stressful situations to the family members or to the entire family. Like for example, pag nabuntis, that would mean that an additional expense for the family. Okay, marriage. Okay, is an example of stress point because one member of the family, particularly or the woman, will need to move out of the home o kaya yung family niya to go with the husband. Okay, so nagkakaroon ng stressful situation kasi magkakaroon ng sudden changes doon sa nakagawian. Okay, same thing with your labor, puerperium, and of course, parenthood kasi hindi naman tayo parents na nag-start. Okay, so once we enter that developmental stage ng ating buhay, especially sa magkasawa, is nagkakaroon ng stressful situation kasi we are adjusting to new possibilities and new conditions that will bring stressful or psychosocial or psychological stress with for us. Okay, another one is additional member. Okay, abortion, entrance at school, adolescence, divorce, or separation. This also includes your menopause, loss of job, hospitalization of a family member, and death of a member. So basically, may kinalaman siya sa gain and loss of a person. So they gain something, they lost something, but the same time, it will affect yung kanilang current conditions or yung kanilang current situation at that moment. And your presence of stress points will score only 1 point. So among the four first level assessments, siya po ang may pinakamababang score. Ibig sabihin, siya ang pinaka-least priority. But of course, it comes with other criteria. So, hindi lang naman po nature of the problem ang criteria natin. Okay, meron pa tayong modifiability of the problem, the preventive potential, and of course, the salience of the problem. And we will try to discuss that on our next video. Okay, so that's the presence of stress point. Okay, so another one is resettlement in a new community. Okay, illegitimacy. These are also examples of your stress point. Okay, now brace yourself. Okay, so we're going to have some examples here. Okay, and as you watch the video, please try to answer. Okay, with me, and we'll try to analyze kung ano yung sagot doon sa mga words or phrases na ipapakita ko sa aking screen. Okay, so let's play a game. So identify the following examples of health problems. So number one is blindness. So I'll give you 5 seconds to think about your answer. Is this an example of a wellness condition, a health deficit, a health threat, or a foreseeable crisis or a stress point? Okay, so let's try to open the camera here. Yeah. Okay. So is blindness. Okay? So, yung iba sa inyo, pag mag-over-rationalize, maaring magkamali sa tanong na ito. Okay? So, let's try to answer. When I talk about blindness, okay, alam na natin, pag sinabi natin blindness, guys, blindness is an example of disability. Okay? Disability. And of course, when I talk about disability, alam natin na this is an example of your health deficit. Okay? Baka po may sumagot sa inyo. Baka po may sumagot sa inyo, no sir, that is a health threat. Bakit siya health threat daw? Kasi nga, pag bulag, walang nakikita, pwedeng madisgrasya. My point. However, okay, we have to generalize the situation. Okay, the situation, the only word that's present here is your blindness. And kahit saan nating tignang anggulo, blindness is an example of disability. And we know that disability is an example of health deficit. Okay, but blindness can also become a health threat depende sa situation. Like for example, okay, yung cause ng blindness would mean that a possibility of a person to to um to be involved in to be involved in accident. Okay, kasi hindi niya nakikita. So pwede siya maging health threat. Okay? Another one is your regular exercise. Ito napakalinaw naman. O sige, 5 seconds. So regular exercise is an example of, is it a wellness condition, health deficit, health threat, or a foreseeable crisis or a stress point? Okay, so 5 seconds. Okay, so when I talk about regular exercise, this is an example of your wellness condition. Okay, because regular exercise is actually a good practice to maintain a person's optimum level of functioning. And this is one way of managing their health, because if you do exercise, it has a lot of good benefits, such as reducing the cholesterol level, and of course, reducing the fat as well, and of course, making the body active, okay, through a constant movement. Okay, another one is hospitalization. Okay, so the word itself, so hospitalization, so we are referring to the a person or a member of the family was hospitalized. Okay, so is it a wellness, a health deficit, a health threat, or a foreseeable crisis? Okay, so this is an example. Okay, hospitalization is an example of your foreseeable crisis. Sir, bakit hospitalization? Malamang may nagkasakit. Yes, may nagkasakit. But ang binabanggit po rito is yung proseso na may na-hospital. Hindi po binanggit mismo yung sakit. Kung ang binanggit dyan is yung sakit mismo, yes, we will be answering your health deficit. However, in this situation, ang in-emphasize is yung moment or yung situation na may isang miyembro ng pamilya na nagkasakit o na-hospital. So basically, this is a situation that brings about stress, okay, or brings stress, okay, to the life of the family. Okay? And of course, it will also needs an adjustment in terms of the resources. Kasi nga, maaring may gastos sa gamot, babayaran, or any expenses in relation to the family member's hospitalization. Okay? Another one, family disunity. Hindi daw magkakasundo ang mga miyembro ng pamilya. Okay? May nagkakagulo sila. Okay? So, is this an example of a wellness? Okay? A health deficit? A foreseeable crisis, or a health threat? Okay, so you can also comment your answers. Okay. By the way, please do like and subscribe naman po sa ating channel. And of course, comment down naman po kayo. Okay, anything that you want to comment, okay, or for improvement, for new topics that you want that you want us to discuss, please do comment po sa ating comment section. Okay, so family disunity is an example of a health threat. Okay, pag hindi po magkakasundo ang members ng ating family, basically it will bring a possible condition in the future na kung saan hindi magtutulungan in terms of health management. So basically, this is an example of a health threat. Okay, another one is malnutrition. Okay, malnutrition. So malnutrition, malnourished. Okay, so can either be an overnourished or undernourished. Okay, so malnutrition. Is it a wellness, health deficit, foreseeable crisis, or health threat? Okay, for this one, this is an example of your health deficit. Okay, health deficit po, kasi ang malnutrition ay isang sakit. Okay, may it be an overnourished or undernourished, sakit pa rin po siya. Okay, that's why this is an example of your health deficit. Okay, I hope that we are still good with this one. Let me continue with the last one. Resettlement in new village. Okay, biglaang paglipat or expected na paglipat sa bagong lugar, bagong kakilala, bagong situation. So that this is an example of your, okay, I know that you know the answer for this one. This is an example of your stress point or your foreseeable crisis. Okay, or your foreseeable crisis. So these are examples, okay, of your first level assessment. Again, may mga conditions tayo na pwedeng maging health deficit at the same time health threat. Like for example, the presence of tuberculosis in the family. Okay, family member. Kung isang family member may tuberculosis, yung condition niya is an example of a health deficit. However, the possibility of the disease to be transferred from one person, from one family member to another, is an example of your health threat. Okay, health threat. Okay, we're done with the first level of assessment. We are now going to the second one, which is the second level of assessment. For second level of assessment, these are identifying. So these, we are going to identify the nature, okay, of the nursing problem the family experience and in the performance of their health tasks. Okay, so this is in relation to the family's performance of health tasks. Okay, so basically, if they are unable to perform the family health task, okay, that is an example of a problem, which is a secondary level assessment. So ano nga ba yung mga problems na ito, sir? Okay, there are actually 5. Number 1 is the inability of the family to recognize the presence of condition or a problem. So basically, hindi nila ina-identify or dinideny nila the presence of the condition. That is an example of the inability to recognize. Okay. Another one is inability to make decisions with respect to appropriate health action. So basically, they know that there is a problem, but they choose not to act on it. Okay? Kasi nga may mga factors like for example, kulang sa pera, okay, or kulang for anything or knowledge. Okay, kulang sila sa alam regarding sa sakit. Next is inability to provide adequate nursing care to the sick or disabled. Okay, improper parenting is an example of this one. Hindi nila maalagaan yung isang bedridden na family member. Those are example of your problem number 3 in relation to the inability or the ability of the family to provide adequate nursing care. Okay, and number 4 is the inability to provide a home environment conducive to health maintenance and personal development. So basically, anything na magkakaroon ng health threat is an example of number 4 problem. Kasi kung hindi mo na maintain yung mga situation that would maintain a healthy environment for the family, okay, that prevent them from acquiring disease, from occurring an accident, is an example of problem number 4, secondary level of assessment. And of course, for number 5, failure to utilize community resources or for healthcare. For example, hindi nagpupunta sa health center, okay, kahit may libreng gamot, hindi nagpupunta sa mga hospital, okay, kahit may mga libreng mga medical missions, hindi sila pupunta, okay, due to any reasons. For example, masungit yung nurse, masungit yung doktor, ang pangit ng experience nila nung last na visit nila. All of those reasons will fall under your level 5, okay, or number 5 sa secondary level of assessment. Kasi kahit anong rason nila, okay, yung hindi pagpunta or pag-utilize ng community resources na meron sa community is an example of a failure of them utilizing whatever is available resources in the community. So those are your secondary level of assessment. Okay. So that ends our discussion for today. I hope that you have learned something. And if you do, or if you did, please comment sa ating comment section. And don't forget to like, share, and of course, subscribe sa ating channel. Pa-comment na lang po ang mga next topic na gusto nyo may discuss natin for the future. And thank you once again for watching. And I'm gonna see you on my next video. Bye for now.